Hi again. Well, I've been involved in this conversation for 50 years. And when I started it, I gave birth in 1970. There was really the first beginning of what was called the natural birth movement. There were people who recognized globally in modern countries that every pregnant woman was being dragged into hospitals, basically. We weren't being dragged in bad term. We were going into hospitals because we wanted to, but we were having these standards of care, these assessments, monitoring, and procedures. And there were people, rightly so, women and birth professionals as well. Lamaze and Bradley were obstetricians, and in New Zealand, Grantley Dick Reed were saying, hey, wait a minute, we're medicalizing all births, and lots of births don't need to have that much assessment, monitoring procedures. And they're right and they're wrong about that. It's complicated. And people in modern countries don't want to birth in the bush. And people who are birthing in the bush would love medical care because there's no way to know what your birth's going to be like. So Lamaze and Bradley and Grantley Dick Reed focused the initial skills on the low-risk normal births for the three goals of having a natural birth, pain-free labor with no medical care, which, as I said, left out the vast majority of us for whatever reason. But that's when the opposition about childbirth started, natural versus medical. And some countries had midwives. In New Zealand, where I live, they had midwives. In America, where I gave birth, they didn't have midwives. So the opposition of obstetrician or doctor versus midwives, home versus hospital, that became, and it's gotten worse and worse and worse over the years. So Birthing Better Families knew that was happening. We were developing these skills during this time, and families just care about their own birth, really tell you the truth. They don't care about anybody else's birth but their own, which is fine. It's how it should be. And the fact is that we could not always control what was happening in our bodies or what was happening in our local area with choices. And it is what it is. And we couldn't change that. We could change us. And so the families with whom I worked, why I have spent 50 years of my life carrying this forward, is because of the families that I worked with. And we developed skills for every birth. We nitpicked apart every gap every woman and every man had. We want to improve our birthing experience and have a safer birth for ourselves and our baby and have a more positive birth. So we picked it apart. If we had to birth in the hospital or wanted to birth in the hospital, and we had assessments, monitoring procedures that are now called interventions, it is what it is. If we birthed at home and there were no midwives in the area, or we had a religious belief that we wouldn't go to the hospital, we still wanted to have a safe birth and we wanted to cope well. We didn't want to have a problem. Birth center was the same way. If we went from a labor to an unplanned cesarean, we didn't want to just throw up our hands and go, oh, we wanted to keep using our skills while we were being prepped and during surgery. This is our baby's birth. We get pregnant to have a baby, not a type of birth or to birth in a certain place. It's an activity. We are doing the activity of birthing our baby actively. We breathe in, we breathe out, our body's someplace, our ability to soften and relax and to think about whether our body's open. This is within our mind and in our capability to link our minds to our bodies. So this goodbye to you in this course is to tell you, use these skills no matter how you birth, no matter where you birth, no matter who is present at the birth, no matter what your personal circumstances are, or your beliefs, or your choices, or your lack of choices, or your choices that change, or what happens to you or around you at the birth. This is your baby's birth. Be skilled, use skills, work together. It is a monumental, life-transforming activity, and you're going to remember it forever. So if you remember being passive, you're not going to feel as good as if you remember actively using skills while they do things to and around you you hate. Honestly, keep passing on these skills because they are so empowering, because we have the capacity to work through our baby's birth journey in all circumstances. Your first-time mothers and fathers, Don't worry about that. Focus on learning the skills. Practice them while you're doing other things in life, with the exception of the internal work, 5 minutes a day from 32 weeks onward. And if you're listening to this at 38 weeks, still do it. And do what you can. Pick and choose the skills you want to learn first. Pick them differently from each of your viewpoints, and then teach each other. You'll make it so much faster. And enjoy learning. Because if you're a skilled mother and a skilled father or other, then you will not be frightened of your newborn. And you will develop skills in that early phase that will carry over for the rest of your life. So, welcome to the Birthing Better family, and go for it. See you later. Bye-bye.